Hello, my name is Kassandra Romas and welcome to 30 Medical Minutes. This is a very special show in which we are going to discuss heart attacks in women, their symptoms, and challenges in diagnosing this disease. There are many challenges as a woman's heart attack usually does not resemble that of a man's heart attack. Our guest today is Dr. Robert Fishberg, a cardiologist and attending physician at Overlook Medical Center. Dr. Fishberg was my guest in February 2012 and was very informative and thorough in describing heart disease in women. I guess I didn't forget that wonderful show because recently I had a heart attack and remembered the advice that Dr. Fishberg offered to you in our audience and to me too. Our show today will be a unique show because Dr. Fishberg will not only discuss symptoms of heart attacks, but he will interview me, asking me to relate all my recent experiences. I will be very happy to share my experience with you, as it has always been my goal to use 30 medical minutes as a vehicle to educate and inform the audience on medical issues. So please stay tuned for a most unique and special edition of 30 Medical Minutes. And now let's welcome Dr. Robert Fishberg to 30 Medical Minutes.
Well, thank you, Kassandra. Great to be back.
I'm glad that you're here.
And this is a fabulous opportunity to talk about heart disease in men and women, talk about your health experience, and talk about the challenges in treating women with heart disease.
You know, Dr. Fishberg, when we had our conversation 7 years ago, I didn't realize that it was going to have such a huge impact on my life, but it has, and I'm going to say now, and I'll say it many times, that I'm extremely grateful to you for your volunteering your time here as my guest, and also for imparting your information and advice so well. It obviously made an impact in my brain.
Thank you. Well, let me tell you a little bit about my background.
Yeah, please do.
So I was a resident at Overlook Hospital from 1981 to 84. I was chief resident at Overlook Hospital.
Oh, I didn't know that. Okay.
And then I went to my cardiology fellowship at University of Connecticut in Hartford. And I came back in practice in New Jersey since 1989. So I've been here for a long time myself. And in my experience, I trained initially as an interventional cardiologist. Those are the cardiologists that do balloon angioplasty and do stents in the coronaries. And more recently, I've transitioned more to preventive cardiology. So I'm in a big group, Associates in Cardiovascular Disease. I'm part of an Atlantic Medical Group, which is a large group of physicians working at Overlook Hospital, Morristown Medical Center, and a few other hospitals around the state. But my goal in practice, again, I see patients every day. I'll see 15 to 30 patients a day, and I see all types of men, women. I don't do children. I don't take care of children. But my passion really is prevention, and diagnosis, heart disease, treating, and again, prevention of heart disease. Mm-hmm. And I've done research in hypercholesterolemia, patients with high cholesterol. I'm very interested in familial hypercholesterolemia. And I'm very interested in risk factors and prevention. And heart disease, as you know, is the #1 killer for both men and women. 1 in 3 deaths are caused by heart disease. And it turns out that for both men and women, 50% of people have heart disease. Most of us don't know it walking around. And that's the challenge with heart disease, is that it is a silent killer. And often you have plaque buildup that develops throughout your adult life. And only when something happens, when a plaque ruptures or a thrombus forms, and you have the event, do you realize how much disease. It's kind of like the Titanic with iceberg. What they see was the tip of the iceberg, everything else was below. Mm-hmm. That's kind of like what heart disease is like. And the symptoms are variable. Usually we think of heart disease in men is more evident, usually a crushing pain in the chest, pain that radiates to the left arm, goes to the jaw, associated with shortness of breath, or palpitations, or sweating. But often heart disease in women is much more subtle. They may just be nauseous. They may have a little epigastric pain. They may have no symptom, very few symptoms at all. So heart disease in women is more challenging because it's not the classic crushing chest pain. And often, even when women go to the emergency room, it's less, the symptoms are less obvious. I hate saying it's not taken as seriously, but again, they assume that a woman who has chest pain, maybe it's a stomach, maybe it's costochondritis, so that they're less likely to be treated aggressively. Again, the symptoms are often more subtle. And the other thing is that women often present with other syndromes that men don't have. There's a syndrome called a broken heart syndrome, which is more of a cardiomyopathy, which is due to stress. We think adrenaline that causes a weakness in the heart muscle. There's a syndrome called SCAD, which is spontaneous coronary dissection, which is a common cause for heart attacks or heart syndromes in women under 50, something that men don't have. They're more likely to have coronary spasm. And there's a syndrome called Minoka, which we'll talk about, which is more common among women than among men. And even when we treat women, it's even more challenging because diagnosis in women is difficult because most of the tests we have are made for men. Stress tests have more artifacts, nuclear stress tests, stress echo, more artifacts in women because of a breast artifact. When you treat women, it's more difficult. The vessels are smaller. So, stents and bypass work better in men with larger vessels. And the other problem is because of estrogen, often heart disease is delayed in women. So while heart disease is more common, say, if you're 50 and 60 in men, in women it's more likely in 60s and 70s, and then you have the added effect of an older person. So it's challenging in women, and men. But I'm interested in your story, what happened to you.
Okay, wow. That's very interesting to hear about all of that. And once again, it's reminding me of what I had learned from you many years ago. But what's important, and what I just got from you, is that for a woman, the symptoms are masked. So as you're saying, when they can go to a hospital, it may not be diagnosed or recognized immediately as a heart attack.
The other problem with women, too, is women are less likely to go to the hospital with chest pain. Women are more stoic. They take pain better than men do. So it's more likely a woman is going to, if they're having pain, they have other things they have to take care of first. So even if they have similar symptoms, they're less likely to seek help because women have other responsibilities. Being a man is very simple. Being a woman, you have more responsibilities. And I get this from my wife. I get it from my daughter, who's a dentist. We live in the area. We live in Westfield. My daughter is a dentist that lives in Millburn and has a practice in Scotch Plains. She has 2 children. And she says her responsibilities are all the time, whether it's working virtually full-time, being active in the PTO, planning the kids' activities. It's never ending for a woman.
I think that's quite right.
For a man, it's easy. We just come home and put on sports. It's fairly simple for men.
Okay. Well, I will tell you about my experience, and I'm going to go into it. I think I'm going to divide it up in two portions because, one, I can discuss with you what my symptoms were, but also my story is a little bit more unique because I was not in the United States when this happened. I was in Greece, where my family we have a family home there, and I had gone there, and it was exactly 2 months ago that I experienced this episode, shall we call it, and I was there to do some work on our family home, which is on an island. So Dr. Fishberg, this is a unique island that's only 2 hours away from the mainland, but it doesn't have an airport. And the only way to get to the island and off of it is by ferry boat. So
Well, it sounds fabulous to me. Idyllic. Who wouldn't want to have a house on this small island in Greece?
it's quite lovely. I have to admit, it's wonderful being there. So,
Was it like Mamma Mia, where everyone's singing, or is it?
well, I'll tell you, the beaches are absolutely fabulous, and this island is not a touristy island, so it's far more family oriented. So you'll go through the town and you'll get a residential feel, and it's really very nice, and I can say that. And my family's been there for centuries, so there's even a few relatives around. So anyway, I was there with my daughter a couple of months ago to do this work, and we came up to a holiday weekend, and my daughter was saying, Mom, let's go to Athens because the workmen won't be here for the next few days. So sure enough, we got on a ferry boat, and while I was on the ferry boat, I now know I experienced my first, but I think milder attack. And my daughter looked up at me and she saw I was ashen. I was sweating profusely. And she asked, Mom, what's the matter? And I said, oh, I think I have heartburn because there was this pressure, very strong pressure on the upper part of my heart, my chest area.
This is on the boat going from your island to the mainland.
Yes, this was on the ferry boat.
And sweating is a common symptom of heart disease.
Yes.
It's just diaphoresis.
Yes,
like
so
that.
I was definitely sweating. I was definitely pale. I was definitely feeling I'm going to call it discomfort because it wasn't a severe pain as if you're passing a kidney stone or something, but it was definitely pressure. So what did I do? I said, oh, I have heartburn. I grabbed an Advil and I took it, and it subsided. So once we got to the mainland and we checked into the hotel we were staying at, and after having a lovely dinner, reading a book and getting ready to fall asleep, all of a sudden I experienced a far more severe pain, but it wasn't as, once again, like a kidney stone type of pain. It was strong pressure, and my heart began to beat wildly. I mean, I could literally see my chest going up and down, my clothes were moving. And I said, oh, wow, well, what do I have, food poisoning? Do I have indigestion? And Dr. Fishberg, even though I'm educated on what a woman's heart attack is, I denied it.
Well, denial is very common, and the smartest people, education doesn't prevent denial. I think none of us are prepared for a heart attack when it comes, even if you know the symptoms. I know numerous stories of cardiologists who, when they had their heart attack, they didn't believe it. They denied it too. So denial is very common with this.
So I told since we were in the hotel room rather than being in separate bedrooms, my daughter noticed my distress, and I couldn't get comfortable. And I would go to the bathroom, I'd come back, and I'd lie down, and my daughter said, what's going on? And I said, oh, I think it's, she says, do you think it's food poisoning? I go, well, I don't know, maybe. So I stayed in that, fighting this. And like you said, women are very stoic. And it's always been my nature to try to cope with things when there are difficulties, just try to see how I can manage it. The glass is always full. And
right, because you have responsibilities. You with your daughter, you have things you want to do. Right.
Right. And to be quite honest with you, I was not in my home setting. I didn't have Overlook Hospital within 10 minutes of my home, and I was reluctant to go to a foreign hospital.
But what made you think this was a heart problem at that point?
Well, very easily, my daughter, being my daughter, who researches everything, took out her phone, went into Google, and she goes, rapid heartbeat, heartburn, and Mr. Google comes up with woman's heart attack. First thing that she saw, and my daughter goes, Mom, do you have this, and this? And I go, Yes, 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 yes. She says, get up, get dressed. We are going to the emergency room right now. So this is where I am so happy, so lucky, so grateful. Before we left the hotel room, I said, bring me 2 aspirin. And I had 2 low-dose aspirin in my med pack, and I took those. And got dressed, and we went down to the lobby, got in a cab, and now we go into a story about the medical situation.
So what made you think to take 2 aspirin? Why did you took that because of
I think because what you told us 7 years ago.
So I think that
I also, and I'm going to be very honest with you, I think that our Lord put it into my head not to forget.
So just for your audience, if you think you're having a heart attack, if you're having chest pain, you're having this diaphoresis, sweating, palpitations, symptoms of a heart attack like that, taking 2 baby aspirins is a very smart thing to do, and calling 911. In the States, I would call 911. Don't drive yourself to the hospital. Don't have your loved one drive you to the hospital. If you really think you're having a heart attack, call 911 and let the medic unit come and assess you and let them take you to the hospital. Because the biggest risk is within the first hour of a heart attack, and you want to be monitored and transported by the medic squad rather than yourself.
And I know they're trained, and their emergency vehicles are filled with equipment that can assist people in the middle of this heart attack.
But that doesn't apply for being in Greece, because who knows, you can't dial 911. You're lucky you had internet access to do Google there.
Well, fortunately, yes, we did have a very good internet access and everything. But you're right. Unfortunately, I don't know. I think they do have an emergency number, but it's not 911. It's some other numbers, which I'm going to have to learn because I hope to be able to go back again one day. But I know that the amount of emergency vehicles, ambulances that they have are limited in number. So what we did is that we went down to the lobby, they called a cab, and this is the part of the story that really is kind of distressing, Dr. Fishberg, because there was a huge medical center right across the boulevard, very famous with some very renowned physicians. And in the cab, we went there, and as we pulled up to the emergency room, it was blockaded and with a guard in front of it. And the taxi driver says, I have a woman here with a heart attack. I want to go to the emergency room. And he goes, sorry, we're closed. We're closed. And he goes, oh, okay, well, where is there a hospital with an open emergency room? And he gave us the name of the hospital, which was about 15 minutes away. And this is very typical of this area. In the region of Athens, which probably services the same amount of people as Manhattan, there are 5 hospitals. And because they're a socialized country with a single payer system, they rotate which hospital emergency room is open that night. So there's only 1 hospital emergency open for that entire region.
That sounds so crazy. Here, it's so, in this area we have multiple hospitals available. You go to the closest hospital, and our goal when someone's having a heart attack is, if we think someone's having a heart attack, we want to get them to the closest emergency room as quickly as possible. And if we think there is a significant heart attack, to have a catheterization as quickly with it. And you want someone from the door of the emergency room to on the catheterization table within 90 minutes or less.
Well,
30 minutes is possible.
Then listen to the rest of the story. Once we got to the emergency room and the aspirin was working, I wasn't feeling as much discomfort, so I was able to walk in. It's a good thing because there was no wheelchairs, stretchers, even doctors or nurses in the emergency room, just packed with people. There was one lady behind a counter, and I told her I was having a heart attack, and she gave me a ticket, a little white piece of paper with a number on it. And she said, this is your number. You have to wait until you're called. So
So in Greece, when you're having a heart attack, it's like going to a deli counter here.
exactly, and I had to wait for my number to come up on the board on the wall before I was seen by the cardiology department.
Even with a presumed heart attack.
With a presumed heart attack. Once I got in, the staff were wonderful. The physicians there, the nursing staff and everything, they took my pulse, they gave me an echo. Apparently, though, I didn't know, one of the doctors went out. EKG, excuse me. Went out into the waiting room and asked for my daughter, who was waiting there with the hordes of people. Miss Romas, your mother is in the middle of a heart attack. Get these papers stamped. So my daughter had to go find the place and get them stamped, and it was another whole story, but she did. And once they were finally stamped and brought back, they were able to take me over to the cardiac unit.
I mean, lucky that you speak Greek. Can imagine someone, an American tourist who this happens to, who doesn't speak Greek, at the mercy of a bureaucratic system like this. It'd be a nightmare.
My daughter doesn't speak as much as I do, and my knowledge of medical terms is limited, but I have to admit that I was taken to the cardiac unit. They tried to do an angiogram on me, but they couldn't do it because my arteries happened to be totally clear.
They did an angiogram is a picture, but there was no need for an angioplasty.
No, that's right, and no need for a stent or a bypass or anything. I think it was probably observation or whatever they did, but I was in their CCU for 4.5 days, then in their ward for another day and a half.
So this happens more commonly in women than in men, where someone comes in, you think it looks like they're having a heart attack. Apparently the EKGs show that the blood levels of troponin. Troponin is a chemical we find in the blood protein which is released with heart damage. So apparently all indications was you had a blocked arteries. When they went in there wasn't a blocked artery.
They couldn't find one.
So this could have been due to spasm, could be done to a thrombus, could be a plaque that was disrupted but wasn't severe enough to show a stenosis. And this is a commonly described syndrome, again, more appreciated recently than before.
Mm-hmm. They did diagnose Minoka, which you mentioned earlier in the show, that I had Minoka, myocardial infarction, non-obstructive coronary arteries.
That's a syndrome.
It's
a syndrome. It's not a disease. We don't know what the disease. I mean, may not even know yet what the disease process was. Was it a plaque disruption? Was it a small dissection?
Was it a thrombus?
Was it a thrombus? Was it spasm? And I heard you had a MRI today.
Yes.
And that actually is one of the better ways to diagnose it, to see if there's any residual damage. Usually with Minoka, there's residual damage. Otherwise, there are syndromes like Takotsubo, which is a broken heart syndrome, or myocarditis, which could look similar. Mm-hmm. And the treatment for this is difficult too, is because again, if there's not a blockage, it's easier sometimes when you put a stent in so you know what you're treating. It's hard to know how to treat Minoka. There has been some studies looking at that. But so your experience with the doctors there, the doctors seemed good once you met the doctors.
Oh my goodness, I was so impressed. I have so much respect for the physicians. Their knowledge was profound and vast, but I think they have to have great knowledge because the amount of technology and equipment that they have was very limited. There was no MRI at all in the entire hospital, which is a teaching hospital. They had their machinery, many times they had to pound it to get it to work. The nurses, the station in the CCU had two monitors, 2 laptops, and that was it. I mean, it was very, very simple. So everything was up here in the doctors' heads, and they had to know it all, but they couldn't verify anything with the backup testing.
You know, we take things for granted in this country because we have such, high-level medical care, and doctors are well trained, nurses are well trained. The equipment we have is phenomenal. So Greece is a European country. You think they would have good medical. I've had similar experience with my son when he was in Europe with the medical. He was in Prague. He had a medical problem, and my wife flew out there, and it was like something out of a post or something like out of a post World War II Russian hospital that he was in.
That's exactly what we found.
And even basic supplies that you have to bring things in.
Oh my goodness! Once we got into a regular room, I had to bring my own toilet paper, my own towels, my everything, my own water, and there were, I think, 2 or 3 nurses for the entire floor of 30 or 40 patients. So unfortunately, as well-meaning as they are, they're definitely limited in the amount of care that they can give. Like I said, it's a socialist government with a socialist medical system. They do not deny anybody care, but at the same time, many people who have serious problems go to other locations out of the country, especially the United States or England, for their serious care.
How do you feel now?
I'm feeling better. I'm not 100% yet, doctor. I'm still feeling the fatigue, but I'm much stronger. When I look back now at how weak I was after that, especially the first week, my entire internal body was very, very sore. And I couldn't even take 2 steps on a staircase. But I'm very happy to say that I feel much stronger. I have a lot more stamina, and I'm looking forward to a full recovery.
What medications are you taking now?
I'm taking things like called diltiazem, metoprolol, atavasine.
So diltiazem is a calcium channel blocker that relaxes the heart. Metoprolol is also a beta blocker that relaxes the heart. That's also helpful after heart attacks. You're still taking a baby an aspirin too.
Oh, absolutely. I don't go without it now.
And aspirin, there's some controversy now about whether women or men should take aspirin. I think the take-home message with aspirin that if you do have had a cardiac event, you've had a stroke, there's some vascular problems, you could continue aspirin. But there is controversy whether everyone should be on aspirin. And the atorvastatin, which is a statin, is important to lower your cholesterol, because it might be that the menorrhea that you had may have to do with the vessel walls, and that by taking a statin, lowering your cholesterol, the vessel walls may improve. Other patients may also be on ACE inhibitor, which is a blood pressure medication that lowers blood pressure too.
Guess what? Our time is up, doctor.
Oh,
I can't believe it.
I thought we were just starting.
I know. I want to thank you for everything, and thank you all for being my guest on 30 Medical Minutes. It's been an honor and a privilege to be your host for 25 years. So once again, thank you for being a part of our audience, and I hope you've learned something. Thank you.